Deadly firefights, jungle labs, extreme rehab. A tiny pill, a huge problem.
In here are more than 1 million methamphetamine tablets that were seized on the border of Thailand and Myanmar.
If we're looking at the number of people who are targeted by these drugs in the market, it's just staggering.
This is the methamphetamine explosion in Southeast Asia. It's the Thailand you might recognise. Monks, meditation, a serene soundscape. But this monastery has a unique ritual. These worshippers are also patients. And they've made a sacred vow to quit YABA, a methamphetamine mixed with caffeine. Fluke works in construction. He says YABA gave him the energy to work. He's been taking 10 pills a day.
On any day that I didn't take it, I wouldn't be able to do anything. I couldn't even sit up straight. I couldn't get up. I would sleep all the time.
Tone, a lorry driver, says the drug is everywhere.
It was available at my job in my neighborhood. I took it to help me work.
Here, going cold turkey means taking sweltering steam baths. But there's another, far more obscure treatment. It starts with a ceremony. Then, a drink. A dark potion of more than 100 secret ingredients. It ends with everyone vomiting.
Why do you think it's been able to grow so much?
There
was a period of time when the government allowed people to have up to 5 tablets of YABA. It encouraged people to take it who had never tried it before. When they took it, they became addicted.
The YABA problem isn't new, but right now it's booming. Dirt cheap and easy to get. Deep in the forests of Myanmar, conflict and lawlessness is the perfect cocktail for methamphetamine production. Crystal meth destined for richer countries, as well as YABA, Shan State, the hub.
Production is happening on an industrial scale, taking place in the middle of a civil war in Myanmar, and a huge amount is getting through this porous border with Thailand.
There are parts of the region where you're probably looking at less than 10 pence for one tablet. So that's incredibly cheap. It's much cheaper than a can of beer in most of these places.
The Golden Triangle used to be the opium capital of the world. Now it's the global centre of synthetic drug production, made possible by a constant stream of precursor chemicals from China and India.
With synthetic drugs, you can essentially produce as much as you want as long as you have access to chemicals and a good chemist and a place where you mix them together. And so there's almost no limit to how much you can produce.
On the outskirts of Bangkok, Thai police have just seized 8 million YABA pills, carried on foot from Myanmar.
It happens a lot. It's a big problem. They're coming in non-stop. It's endless. The natural border is very long, very large. Even though officers are closely monitoring it, smugglers are still able to slip through all the time.
And this is where they're slipping through. Dark, vast forests. Smart smugglers making the most of a huge border.
This is the kind of dense terrain that smugglers are managing to move through in groups of between 10 and 50 people, and many of them are armed with AK-47s.
It's a deadly game of whack-a-mole for the Thai military. This unit had more than 20 violent clashes last year, with 9 smugglers killed.
As soon as we spot them,
we demand a search of them. But the smugglers often shoot at us, because what they're carrying is illegal.
Why do you think there's been such an explosion in YABA?
ยาเสพติดเนี่ยมันผลิตใน
Drugs are manufactured in these ethnic minority areas in Myanmar, where soldiers from neighbouring countries are unable to operate. The groups need income to fund their militia forces.
The military regime in Myanmar is also profiting from YABA. And no matter how much the Thai police try to seize, this is a supply-driven market, and war-torn Myanmar is flooding it. Cordelia Lynch, Sky News on the Thai-Myanmar border.